Welcome, my name is Brian Velikov. Today we are going to talk about HAL, which stands for Hand Activity Level. So today's lecture, you should first understand what parameters we're using for the TLVs considered this hand activity, and then what demonstrates how we're using it competently, and how the risk is estimated with HAL. And lastly, identify tasks that are appropriate for using this HAL, especially in what regards to the TLV. So before we start along, I encourage you to either look at one of these two websites. So this is one of my websites on the top that you can get the questionnaire for the HAL, or you could go directly to Dr. Bernard's website here, and I listed that as well. So why do we care about hand injuries? So we care because, the upper extremity accounts for 20% of all workplaces, and this was a more recent study in 2024. So it definitely affects our workers. So this is an example of that questionnaire for HAL that I recommended. So if you go to my website here, you can pause this video and download that so you can work along with this. And so I think that works along best, just to have a practice with it before you actually utilize this in the field. So the ACGIH stands for American Conference of Governmental Industrial Hygienists. So if you look at this book, all the TLVs are in here, and the HAL is more explained in a greater detail if you go to this book. But following this lecture, you should have a good idea on how to use it. So other important note that could be a little confusing, HAL was updated in 2018. So there we have two different TLVs. If you've been around for a while, you probably use the older one for 2001, but recognize there's two different ones, and the update is more protective level for the TLV, so it's a little lower. So you could see that demonstration on these two graphs, how that modeling pretty similar really, but the modifiers are a little different. In this graph, when you're determining a TLV, it's usually the easiest rather than doing the calculation. You could go straight to two variables, really. It amounts to force, which is this top, y-axis, or the frequency, which is the x-axis here. So those are the most two important factors for HAL. And important consideration with these TLVs, these are just for the workplace. This is not for non-occupational. So think of pregnancy, arthritis, obesity, all kinds of different factors can affect the hand. It's not made for that. It's just made for using occupational. So like this top one. So we have the grinding, for example. So I've done a lot of studies following grinders, and yes, they do have a lot of shoulder issues with TOS, but they could have issues with the hand and the wrist with tendonitis or decoil veins. Just that repetitive, prolonged posture stand-ins, or other example would be these overhead workers. Right now I have a study with auto repair people. Again, similar thing, all three conditions, a lot of repetitive stress, a lot of awkward postures. So when using the HAL, the evaluation is based on hand activity, so the motions and the level of effort, which is the force, as well as lastly, we consider the posture for those cycles. So again, that first step is 0 to 10, determining that activity level. And the most important consideration when determining that activity is subjective by the observer. You, as the observer, are utilizing this tool and determining this frequency. So this is that frequency 0 and 10. Right here in the middle here, we got 4 slow, steady motions, frequently pauses. Or we have 6, a steady motion, infrequent pauses. At a 10, they can't keep up pretty much. So this is all based on Dr. Tom Bernard from the University of Florida. He designed the HAL. Second step is determining that force. So we usually use the Borg scale, and this effort is trying to categorize the effort level by that worker on that cycle. And so this is a hand dynamometer that often we use that's accurate. So, there's going to be different ways of doing this. But using this hand dynamometer, you tell them to squeeze as hard as they can for 3 times, and that kind of determines their max force. So if it's at, PSI of 60, for example, and that's the, most that they can squeeze that gives the worker idea how much they can squeeze. So then you ask them, compared to that maximum, what does that compare to what your task is? And they'll say, a scale 0 to 10. And oftentimes workers, I find, actually say a little less than you expect. So this is that evaluation of the scales. So this first column is that percent that they can do it on. So if you're doing a hand dynamometer, if it's 50% of that maximum, we're at 5 here. Or you could ask them so that subjective scale is actually verbally asking them. And then you, as an observer, can actually rank it, and this is the alternative approach. So usually using facial expressions can really home in on that. If they're seeming like they're, grunting a little bit, that could be a 7. But if they're really relaxed, it seems like a test that's, hardly anything. It could be a 0.1 to 2 pretty easily. So this is determining that TLV. So we'll go through an example, but I want you to see important things about how we're ranking it before we actually do one. So one is we're doing each side separately, so the left and the right hand. And then we can normalize this peak scale. It gives us the TLV. We determine that if the AL, which is the action limit, is above or below the TLV is pretty much what we're homing in on for our recommendations. So on this example, we can see that the left hand is below the TLV while the right hand reaches that AL level, and that is worth watching. So it's right here. And so it's just brunching along that red. Red is above that TLV, so high risk is considered non-safe. So other considerations is how many hours a day do the workers do their activity? Are there complaints associated with the task? And then you can start thinking what kind of improvements come to mind. So this HAL, even though it's been around and validated, there is pros and cons. So I think the biggest con is observational for that, especially that frequency part. However, that makes it very straightforward and easy to use. And then obviously the biggest con is that observer bias. So it's you determining that. You can use direct measurements. This is why we say it's semi-qualitative, so such as that force. Different ways you can measure that force to actually use instruments. So it's getting it uses some qualitative and some quantitative and qualitative. So this is examples. So I was in Puerto Rico doing a research study, and this is at their Bacardi plant where they make rum, and they were doing bottle inspections. So while doing this, how you want to identify the hand tasks that are happening. So on this one, we'll go through the video on the next slide, but the bottles are in there. They grip it with one hand. They bring it up, they twist it, and then they inspect the bottom and then put it back in. So we got, 7 tasks pretty much, but it's the same motion with the hands. You could say that beginning one is more of a pinch rather than a grip. And so you could separate those out. Or you could just say it's all one activity as average. So then you want to determine, how long. Usually we say a cycle is when they first grab that object and then let go of that object. That is considered one cycle usually. And you determine how long they're doing it, asking do you do this for a 2-hour shift and then take a break? So those could give you an idea. So when you're doing that HAL, again, ideally you would have 3 independent observers doing this as part of that protocol, rating the force and the frequency. And then at the end, you consider, is there other postures involved, awkward postures? And then you might actually increase the TLV if there is sustained awkward postures. And then lastly, that multitask. So we'll go through an example of a multitask, but you could do a time-weighted average with that. So let's do an example. Oh, here's that, what they're doing for that. Sorry. I'll actually click it right now so you can see that. So for frequency, we're trying to determine what is that work cycle and from when they let it go, so they're picking it up, and you can count down. So this is pretty steady motion and frequent pauses, I would say, but it's determined, do you think this is slow and steady or steady motion? I would definitely say they're not, they're able to keep up. They look relaxed. So maybe slow, steady motion expert, frequent pauses. Just because you could say that pause in between when they let it go and it go to the next one, but it's in between. I would say a 4 and a 6 on this, so maybe a 5 for frequency. All right. And then that force. So we are determining force different ways we could do it. Like I said, the first one, that Borg, is probably the most common, where you're asking that the second column here, rating them, and that you could train them by using something they could squeeze as hard as they can and say that's a 10. And then they can rate it based on that percentage. You could use instrument scales where they're actually using like grip meters or pinch. Um, and then you could use ways to train it, a worker to determine how much force, such as if it's more of a pinch, they could be cutting something, and to get that idea, because people have a harder time, I think, with pinch than they do grip on rating this. But as you see, this normalized peak force is what the peak force is divided by the strength. So again, if the max they can do it is that peak force, is that 10, 100% divided by whatever the object is. So if they say it was, a strong and heavy, we would rate that at 50. So, we're at 50% there, 50 times 100%. So that gives you an idea how to do the force. We'll do this example in class, just to give a link here. This is an example how we have multiple tasks involved in one, which is pretty common, especially for any material handling. So for this one, multi-cycle, we're saying it's 15 seconds a piece. They put the bottle on the bottle stand. They're putting plastic labels on there. So they're putting multiple cans on there. So it's the top wrapping, plastic wrapping. After they get it, they have to put this press down, use pretty significant force. I think the worker put it at a 6 normally, and then they, use one hand and place it off to the side. So just given, even though it's multitask, it happens about 50 seconds, they have that. So that gives you an example how we're doing a multitask with a time-weighted average. Lastly, we want to do evaluation. So based on this, I think this is a correct here. I would say instead of a 2, it's a 4, sorry. And so right there, I think if we put the force is at 2, I made a mistake. I need to correct that. That puts us in the action limit. I would say if it was colored, this would be the yellow, green, and red on the top. So still in the safe value for the bottle inspection. Again, I mentioned that, not only are you judging force and frequency, but also lastly, you want to consider what postures. And so you might elevate those modifiers based on the posture. So, or if there's contact stress or all those ergonomic risk factors we've been talking a lot about. So low temperatures, vibrations, all of those might increase your modifiers for your recommendations. So hierarchy of controls, remember this, it just is, elimination, substitution, engineering controls, administration controls, and PPE. So on this HAL, if it's exceeding the TLV, we usually recommend some kind of engineering control and say this task is not safe for the worker. But if it's above that action limit, it really depends on your company. So it's really based on what your company policy is. And so usually what I see is people adopt that they want to survey and see if there's an increase in injuries and then make some recommendations on the improvements. All right, so this concludes our HAL today. So hopefully you can describe the elements of the HAL, demonstrate when you would use it, and what kind of thinking about what kind of job interventions you want to use for this HAL. Thank you so much. Have a great day.